Okay, so thank you very much, everyone, for joining us this evening for today's talk. It's really nice to see quite a few new faces and new names. So welcome to everyone, even if you haven't come along to one of our events before. I'm Harry, the president of the Free Speech Society, and we are very excited to be joined by Iram, who's a Master's of Health and Psychology graduate and a member of the Drug Science Student Society, for this collaborative event with the Drug Science and Psychedelic Research Society here at the University of Bristol, virtually, obviously. Iram is working towards a PhD in young people's mental health and substance misuse, and her talk today will be about the research potentials of various controlled substances and the legal problems to overcome in order to perform such science. As was reported in a recent Guardian article, the University of Bristol has changed its drug policy from prevention to harm reduction, which reflects a shift in approach that is taking place in universities and other institutions across the country. Together, we will discuss the dangers of suppressing information on drug safety and why censorship in academia regarding controlled substances must stop. We will be taking questions throughout, which can be submitted online via Slido. Those will be put in the chat on this Zoom event and also on the live stream on Facebook. And if I can ask you guys to please turn off your microphones or mute your microphones until we have the Q&A later, but do feel free to keep your cameras on, although bear in mind this is being recorded, but it is going to be recorded on SpeakerView, so you probably won't be seen. With all of that said and done, thank you for coming. I'm going to pass you over to Liam just to introduce the Drug Society here at Bristol.
Thank you, Harry. Hey guys, my name is Liam. I'm the Drug Science and Psychedelic Research Society president at the University of Bristol. One of our aims is to provide a platform for open discussion and resource sharing of anything related to drug science and psychedelics, building from a foundation of science, welfare and harm reduction. We're also a student branch of the Drug Science Charity, which is the leading independent scientific body on drugs in the UK. And they work to provide clear evidence-based information without political or commercial interference. That's all from me. Now over to you, Iram.
Hi everyone, thank you for coming. So I'm a member of the Drug Science Student Society, which is a student-led group aiming to provide evidence-based education on all psychoactive substances. And I'm just going to screen share now and my presentation, 1 second. Okay, can everyone see okay? Okay, cool. Thank you. So I'm going to be talking about drugs, freedom of speech in drug science, in collaboration with Drug Science and Psychedelic Research Society of the University of Bristol and Bristol Free Speech Society. So I'll be talking about the research potentials of controlled substances, particularly psychedelics in medicine, the legal problems to overcome in order to perform such science, and censorship and suppression of information for drug policy change and drug education. For those who are not familiar, these are some of the definitions. So a controlled substance is a drug or other substance that is tightly controlled by the government because it may be abused or cause addiction. Psychedelics, also known as hallucinogens, are a class of psychoactive substances that produce changes in perception, mood, and cognitive processes. So the research potentials of psychedelics, throughout the late 1950s and 1960s, psychedelic drugs were investigated as potential treatments in hundreds of clinical studies. One of the starting points for this research was to investigate the potential for psychedelic medications to ease symptoms associated with terminal illness such as cancer. Even today, cancer is a leading cause of death worldwide. Depression and anxiety are the common psychiatric conditions associated with a cancer diagnosis, even before then and even now. So we're going to look at some studies which looked at the use of psychedelic in treating anxiety and depression with a cancer diagnosis. So Fang et al. Published a study in 1969 with a sample of 22 terminally ill cancer patients who received a high dose of LSD. These psychological assessments were done using the emotional conditioning rating scale. This had 6 categories: depression, psychological isolation, anxiety, difficulty in medical management, fear of death, and preoccupation with pain. From the 22 patients, 14 showed positive changes and a further 6 patients showed dramatic improvement. Another study was conducted by Groff et al. In 1973 with 60 cancer patients. In these patients, 44 were administered with LSD alongside psychotherapy. 19 patients received DPT, which is another form of psychedelic compound, and 3 patients received both LSD and DPT on different sessions. In these patients, 29 of the patients showed dramatic improvement and 41.9% showed moderate improvement. But more recently, a double-blinded placebo-controlled crossover trial was conducted by Ross et al. With 29 patients who had cancer-related anxiety and depression. Treatment with single-dose psilocybin versus 1 dosing session of an active control, niacin, which is a form of vitamin B3, in conjunction with psychotherapy. So one half of the patients received a single-dose psilocybin and another received the active control. The patient group who received the single dose of psilocybin showed rapid, robust, and sustained clinical benefits in terms of reduction of anxiety and depression. Psilocybin decreased cancer-related demoralization, which included emotions such as loss of hope, loss of meaning, and improved spiritual well-being, so the general quality of life and the general well-being. So though this study had a small sample size and non-nationally represented cancer patients, as did the ones before as well in the earlier studies, the long-term findings of these studies have found psychedelic-assisted psychotherapy holds potential in long-term relief of cancer-related psychiatric distress. This particular study by Ross et al. In 2016 had a follow-up reported in 2020. From those 29 patients, 15 of the 16 patients who were alive reported reduction in anxiety, depression, hopelessness, and death anxiety at the first and second follow-up, and 60 to 80% met the criteria for clinically significant antidepressant or anti-anxiety responses. Even though the amount of patients who may have these significant effects from the conditions, such as anxiety and depression, they are very severe. They lead to the patients wanting to commit suicide. They lead to the patients wanting a more quicker death, a more faster death, and generally decreases their quality of life. So we're looking at the potential of seeing if pharmacological psychosocial interventions can potentially serve as a safeguard against negative clinical outcomes. So a lot of studies were done in the 1950s and 1960s with psychedelics. There was a lot of interest, for example, in LSD. Hundreds of psychiatrists worldwide conducted clinical trials with LSD, and results were overwhelmingly positive, describing safe and effective treatment. There were some patients in these trials, and even now in the more recent trials, who do experience distress, for example, anxiety and other forms of distress, especially if they've already suffered from anxiety or depression. But usually these effects are not long lasting. The patients are okay after a few hours or after a few days, and they'll receive support from the therapist. All drugs tend to come with a risk anyway, so the majority of results from these studies show that psychedelics do have potential in a psychologically supported environment for, helping people with death anxiety, for example. But psychedelics, such as LSD, have not only been used for long-term, for life-threatening conditions, they've also been used for other clinical trials and other health conditions, such as alcoholism. So over here, Krebs and Johansson combined the results of 6 LSD trials. There were 536 adult participants altogether, and all of them were seeking treatment for alcohol use disorder as their primary outcome, as their primary problem. From the 536 adult participants, 325 were randomly assigned to receive a full dose of LSD, and 211 to a control condition. So the results showed that the participants who received a single dose of LSD showed positive effect in the follow-up, which was 1 to 2 months after discharge, and also 6 months after the LSD administration. Each trial did have its own weaknesses. There were only 2 females, and the trials had small participant numbers, but they still show potential for helping with alcohol use disorder and help with the condition. So And that's good because we can use this data to expand our knowledge, because alcohol use disorder is still a serious health condition and cause of death today. For example, in the UK in 2018, there were 7,551 alcohol-specific deaths, and the COVID-19 pandemic has increased alcohol use and binge drinking behaviour. So 38% of adults were risky drinkers in April 2020, compared with 25% in the year prior, between April 2019 and February 2020. So the question remains, what's stopping us from continuing this literature, continuing this research, continuing trials to see the medical potentials of the psychedelics? Where do they fit in medicine? So we'll talk about the barriers which suppress us from continuing research with psychedelics, and it's the law and the scheduling of psychedelics. So here we talk about two of the laws: the Single Convention on Narcotic Drugs of 1961, which is an international treaty to prohibit production and supply of specific drugs and drugs with similar effects, except under license for specific purposes such as medical treatment and research. The 1971 UN Convention, which establishes an international control system for psychotropic substances. And also the 2001 regulation determines in what circumstances it is lawful to possess, supply, produce, export and import controlled drugs. So there's 5 schedules. Schedule 1 is the most restrictive control, and Schedule 5, the drugs in Schedule 1 have the most restrictive control. The drugs in Schedule 5 contain drugs which are commonly available as over-the-counter medicines. I'm going to be touching on Schedule 1 and Schedule 2. So Schedule 1 is where psilocybin and LSD fall in, and MDMA. I just spoke about the psilocybin and LSD. So they may be used for research purposes, but you have to have a home office license. And Schedule 2 are drugs which can be prescribed and therefore legally possessed and supplied by pharmacists and doctors. They can also be possessed lawfully by anyone who has a prescription, for example, cannabis. So technically, it is not the law that is prohibiting us from conducting the research, but the barriers placed by law. So over here, you can see except under license for specific purposes, such as medical treatment and research. And over here, it says, but a home office license is required. So it's not the law itself, but it's actually the barriers placed by law, and these licenses are one of them. Censorship and suppression of information. So these barriers are effective because they cost time and money. They are extremely expensive. And the process involved in obtaining them is very lengthy. So for psilocybin, this information is taken from the Conservative Drug Policy Reform Group's website. There's delays of up to 6 months to a year, and the starting prices for some labs can be 3,000 to 20,000, and per dose is 1,500. There's also stigma and fear due to the way drugs are perceived by law. So, for example, they are in Class A Schedule 1, known as they have absolutely no medical potential and they are addictive. However, we know that this is untrue because there's quite a lot of research already done from the 1950s and 1960s on the medical potential, the therapeutic potential of psychedelics like LSD, psilocybin, and even some recent ones as well. And with it saying no medical potential, or that there's not enough evidence for its potential for them to reschedule the drugs, for example, psilocybin, well, we can't provide further evidence for the medical potential because we're unable to conduct research trials due to the time and the money, and due to the several barriers that are placed. The fear that they're addictive, that is also a misperception because a lot of studies are done, for example, with alcohol use disorder. A lot of the patients showed positive effects. There's also literature out there where psychedelics have been used to combat tobacco addiction. So these are misperceptions and they get in the way of clinical trials being conducted. The Conservative Drug Policy Reform Group is actually doing a Sign, Send, Subscribe campaign where you can, where they are calling for the Home Office to review psilocybin scheduling. They ask everybody to, look at do some research, look at the potentials of drugs such as psilocybin. They're particularly looking at psilocybin, and write a letter to the Home Office. So you can read the report, which is freely available on their website, a medicinal use of psilocybin report. It tells you whether these drugs are toxic, how addictive they are, what is the what are the actual problems, what is research showing us. Yeah, so if you would like to send a letter to the Home Office about rescheduling psilocybin, I'll leave a link in the notes notes box later, and you can find a template on their website. They also encourage you to conduct your own research and, you know, put a little bit of personal touch why you personally may want the rescheduling of psilocybin. So this chart shows how the UN Convention destroyed research. So this one shows about psychedelics. So you can see over here, the 1971 convention began, where control came onto the psychedelic drugs. And this is how much like research used to be done. There were clinical trials, research used to be conducted, experiments could be done to see their potentials. And then there's a massive dip. There's just a dip from 1990, and it just stays here all the way up until 2010, where research started to pick up again for psychedelics. This is up to 2016, but now in 2020, I think it's a little bit more up here. It's still nowhere near where it used to be. And that's why we want to change the laws regarding the psychedelic drugs so that we can continue the research and overcome the barriers of time and money. So this is how cannabis has been affected. So there was plenty of research being done over here, and then they got changed into Schedule 1 drug, and there was a massive dip in research up until closer to 2010, when the laws around cannabis began changing again. But there's a lot more research around cannabis now because their laws changed sooner, and that's kind of what we want for psychedelics as well, because they're class B. So I just wanted to also comment that even though medical cannabis was legalized in November 2018, it still remains inaccessible. A very small number of patients with limited range of conditions have been provided treatment within the NHS. So you can read this paper by Dr. Schlack, where she talks about this in a lot more detail. But you can see that UK was, the year of legalization was 2018, and less than 10 NHS patients have received cannabis for medical conditions, compared to Germany, who legalized it the year before in 2017, and there's 60,000 to 80,000 patients, and Australia, who did 2016, and there's more than 10,000. So UK is far behind from the rest of the countries. So apart from law, we also have political censorship. So Professor David Nutt, who was removed from his position as Chief Advisor of the Advisory Council on the Misuse of Drugs in October 2009, he provided, with a team, he provided scientific evidence that cannabis was less harmful than alcohol and tobacco back when this study was done in 2010. They provided a multi-criteria decision analysis of drugs and the harm they cause to users and others. For this multi-criteria decision analysis, there were 30 experts looked at all the harms that drugs produce. Thousands of harms were condensed into 16 different variables, 9 of which harmed the user and remaining 7 harmed society. 20 drugs, legal and illegal, were then ranked against these 16 variables. So you can see over here, back then, alcohol was the highest, and then heroin, and even in 2010, you know, there were arguments being made that we should change the policy and the law around the drugs, because LSD and mushrooms, psilocybin, which we've just spoken about earlier, are right at the end of the bar for harming others or themselves. I highly recommend you read these 2 papers. So the first one is the one which talks about the multi-criteria decision analysis, if you want to read in more detail, and the second one is the Groundhog Decade, Not Brave New World, by Professor Nutt as well, which shows that even a decade later, UK drug policies have not shown improvement. So there's also censorship on campus, which is also a barrier for us. Universities are failing to acknowledge the presence of drug use on campus. Students are not receiving drug harm reduction education, and there's a lack of support for drug use as well. The aim of drug harm reduction education is to reduce the harm people may cause to themselves or others, but the usual generic drug education that, you know, they receive in universities or even sooner is all centered around preventing drug use altogether. And this results in serious consequences. So this is earlier in this year, in early October 2020, where 4 young people died from accidental overdose. So this is the same paper as well. And then this one was in 2019. So the student became ill and died after taking an unidentified substance at an event off the campus. So yeah, it's having serious consequences because students should be taught about drug education and drug harm reduction, how to safely consume drug if they do choose to do it, because drugs are seen as a subculture within the university life, and a lot of students choose to consume drugs out of curiosity and with their friends and for recreational purposes. So it's a issue, it's a topic that universities need to start acknowledging and recognizing, instead of taking an irresponsible approach of not acknowledging it and not providing adequate education or trainings. One of the problems is zero tolerance policies, which is a main issue on campus. Students are only informed of the disciplinary actions and consequences which can impact the students' academic studies and career. So this is the one from Exeter University. And you can see there's a clear zero tolerance approach. And University of Reading also says we operate drug searches in our bars and venues and across campus. If you are found to be in possession of drugs, you will be subject to disciplinary procedures. So by having these zero tolerance policies, students are not going to approach staff and counselling departments for help for themselves or for their peers, whether they're addicted to drugs or whether they're using it mildly, because there's just serious consequences. And this is especially the case for medical students and pharmacy students. But things are moving forward, and Bristol University is leading the way with everything harm reduction for young people especially. This is some information from their recent drug policy. So they really took a harm reduction approach instead of a zero tolerance, and gave a very welcomed, like, we will support you. The University of Bristol understands that students use alcohol and other drugs. We also understand that a zero tolerance stance is harmful and damaging, as it prevents students reaching out as they may fear being punished. So we need students to not be scared to reach out for help for themselves or their peers, and to prevent young people's accidental overdose deaths. University of Bristol is now also handing out free drug testing kits so students can check the substances that they are consuming. Which is also a great move. And Students for Sensible Drug Policy UK is working to promote the idea of drug testing kits across universities across the country. University of Manchester is also moving forward. So Students for Sensible Drug Policy Manchester is working with a team to develop a new alcohol and substance misuse policy. And also recently we won some funding to have drug testing kits, and also providing a separate alcohol and drugs counsellor. So things are moving forward on campus, which we need them to. Which is good and can prevent deaths. And there's also surveys being conducted now with more recognition so these surveys, they're recognising that mental health it is causing drug use as well, or that it's used for recreational purposes, like identifying the reasons behind drug use in young people. With these outcomes, they can promote more harm reduction approach on campuses. They can show that drug use is common within young people and we need to take a more harm reduction approach. We do need to change policies as well, the university policies and like the government policies as well. This is actually one of the surveys which is being done right now, and Neurosci and SSDP have collaborated together. So if you're a student in the UK, please do take part in this. You also have a chance of winning a £30 Amazon voucher. So also, we're moving forward by campaigns being done for drug policy reform. So this is Anyone's Child, which is Families United for Safer Drug Policies. They have lost loved ones, mostly young people, due to accidental drug overdoses. If you go on their website, you can hear the personal first-hand stories. A lot of them have happened on campus, and they're mostly young people. The families have been broken apart because of these deaths, and so now they're campaigning for drug policy reform. So they ask that individuals write to MPs to take drug policy reform seriously, and they provide activist training. So if you want to do something within your community, your area, or at your university, they provide you training. Something that I also recently found out was that if your MPs are pro-drug policy reform, you should still send out a letter, because it helps them increase their case. It helps them get more numbers and show that there's a lot of people who want drug policy reform to be taken seriously in a positive way. So I highly recommend that you go onto the website and send a letter to your local MP to take drug policy reform seriously. I'll leave a link for that in the description and for this survey. I'm going to minimize my screen actually, because I wanted to ask some audience questions in the chat, which I think I can. I think I have to stop sharing. Sorry. So yeah, if you could probably comment in the notes box about your own opinions on drug policy, on some of the questions that I have. So do you think psychedelics show potential in medicine? Do you have any opinions on that?
Do you want audience members to switch on the microphone and answer?
Oh, yes, please. Sorry. You can do that even, or type in the chat box.
How about maybe Harry? Harry, do you want to kind of, if someone wants to say something, they can wave the hand and you'll call them up for it.
Yeah, absolutely. Yeah. So yeah, just give a signal. You don't have to turn your camera on, but just give a signal if you want to say something, or turn on your camera. So maybe, is that Ben?
Yeah. Hi. We can also use reactors, things like that, if people want to speak up and make themselves known. But on this kind of question, I study medicine here at Bristol, and quite recently, actually, I was having a talk with a GP that we have like tutorials with about this very thing, about a patient that she had who wanted to get who wanted to go to a specialised clinic for using cannabis as a painkiller, basically, and he'd got all of this evidence together to show to his GP why he should be referred to it. From what you've shown, Iram, today, that there seems to be a huge amount of evidence in favour of recreational drugs having a therapeutic effect. But even despite this evidence, the GP that I was speaking to still had big reservations about referring this patient, despite the fact that the evidence was in favour. But when she spoke to us as students, everybody at our age was unanimously in favour that people should be have that right to seek that kind of treatment. And it seems that the only thing that makes doctors unwilling to refer patients for this kind of drug treatment is simply because of the laws put in place mean that there is still stigma among the medical community.
Yeah, and that was something I forgot to mention on the cannabis slide, that even though they have been legalized for medical purposes, a lot of doctors and psychiatrists, they don't prescribe it still due to the stigma and due to the ongoing conversations around its values. So does anybody have any opinions on rescheduling psychedelics? Do you think that should happen or not yet? We should continue waiting?
Perhaps someone from the Psychedelic Research Society here at the uni would like to comment on that.
Yeah, I think that there is quite some substantial evidence to reschedule them. I obviously don't think that they should be sold in shops in a similar way to how alcohol is, or even though that's done in places like the Netherlands with truffles that have psilocybin in them. I think that there is quite a lot of evidence to show that the kind of main ones of LSD and mushrooms are relatively safe to be consumed, as long as people understand that it's not a party drug. It's not something that you take and go out and expect to just have a good time. It can have pretty profound effects on your mental health. So I think that there is quite a lot of evidence to suggest that they should be rescheduled, but obviously there needs to be some level of of guidance around how to use them, what kind of settings are right, because they're not risk-free at the end of the day.
I think Ben Watson raised hand.
I missed that. Go for it, please, Ben Watson.
So hello, everybody. Yeah, I agree with what those guys just said as well. I think for therapeutically, I mean, the main thing with psychedelics, I think, is that society needs like way more education, even kind of within various cultures, even like within certain kind of rave cultures as well. I think people abuse psychedelics and they use them in a kind of bravado way of like, look how much I can take and look how far I can go. So I think that there needs to be more education and a more kind of I don't know, a positive interaction with them. But definitely I've microdosed with mushrooms before, like at various times, and it's definitely helped me. It's had different effects, different mushrooms and different doses, but it's definitely helped me with depression at times. So I think the effects of psilocybin are definite for kind of therapeutic value. How that's done and in what way that's done definitely needs to be kind of ironed out, I think. But I think that it's criminal that they haven't been more kind of consciously dealt with in the last kind of 30, 40 years.
Yeah. I feel like we need opportunities to do the clinical trials to see where they fit in the medical field, to see what their potential is, what the risks and benefits are, to explore more properly instead of just putting regulation policies.
Sorry, could I just add on to what Ben was saying? I think there's another aspect to this, sort of on the educational front to this, which is the UK has a very intense drug culture. It's also not something that is often talked about, that as you mentioned, people do try and just take more of it as it's like a competition, and that's again an educational failure, whereas in the government's taken the approach that if we can just ban it, then there doesn't need to be the education because people will know not to use it.
But that's causing more problems because young people are going to use it, but they're not aware of the safe ways of consuming, the harms that they need to be aware of, which is causing more overdose deaths, accidental overdose deaths.
Yeah, and especially with drugs like LSD, where there's a chance of it not being LSD or being something in the MBOME family, which can be often missold, which actually can kill you if you take too much of it.
Yeah.
Sam H, was that a question or an agreement?
Yeah, well, yeah, it was an agreement.
Or a point.
I've just got a story to tell about a friend who recently, within the last 12 months, took psychedelics. So the background of the story was that she's in her 40s. She was suffering with severe depression after being diagnosed with cancer. She was taking cocaine and she was alcohol dependent for most of her adult life. And she was basically on the verge of suicide, and she went to an ayahuasca ceremony in Spain. And when she come back, she was no longer alcohol dependent. You can probably hear a cat meowing. She was no longer taking cocaine, and she was offered antidepressants. And it's nearly 12 months down the line, and she sort of attributes that experience to sort of turning her life around, which she said was the final sort of step to recovery, really. It was either that or she was going to commit suicide, sort of thing. So that's just obviously one person, but quite a profound experience that I've heard from.
Thank you for sharing.
Thank you so much for sharing.
I had two more questions for the audience, especially for the university students. Does your university provide drug and harm reduction education? Have you noticed any drug and harm reduction education on campus, either via educational material, leaflets, pamphlets, or on-campus courses?
Hi, Iram.
Hi.
Hi, I've come up as Oren, but I'm Abigail Hinton. You gave a chat to the MSc Health Psychology at the University of Gloucester.
Just replying to your comment in the chat. Yeah, I received your email, and I will send you a more in-depth answer via email.
Yeah, so there's nothing set up in our university, and so it would be of interest to do such a thing. I think it'd be really beneficial, to be honest with you.
Yeah, when I gave a talk to your class, I was really excited to know that health psychology students were interested in addiction and substance misuse and the prevention. I'm a graduate in health psychology, and this wasn't really touched on a lot, even in class, never mind on campus. So that was really good. But SSDP is a society which is setting up in all of the loads of universities, and many members. Anybody can open up one in their studies, in their university campuses as well. I'll email you more information on that, and you can also look into setting up a drug science student society. So I'll send you more information on that as well.
That's brilliant. Thank you, Iram.
Thank you. So could you just reiterate that question again, please, Iram? And we'll see if other people have some more responses to that.
Yeah. Does your university provide drug and harm reduction education?
Hi. The University of Manchester provides harm reduction education, but only exclusively for alcohol.
And that's what Yulia has also mentioned in the comments, that apart from alcohol, even UCL doesn't provide any drug education harm reduction. So there's definitely a missing gap that needs to be filled. Is there anybody else who needs to add anything? I will move on to the last question, which is, have you ever read your campus alcohol or substance misuse policy? And if so, what was your opinion?
I vaguely remember reading the one for Bristol last year at some point. I remember being quite punitive, but obviously that seems to have changed this year. I mean, there was some guidance around if you're struggling with alcohol specifically, or misuse. It was kind of implied that if you're misusing drugs, then you can come to the sort of, I guess, the therapy and the people here that deal with that kind of stuff. But it still seemed that if you're caught with drugs in your flat or on campus, then it does seem still relatively punitive. Yeah.
It just causes a lot of, I feel like the policies are very fear-based, so students are just very afraid to seek help, either from staff such as in the counselling department, or even anybody else, or even actually whilst helping the SSDP MC on the university policy, a lot of the students, especially medical and pharmacy students, said they wouldn't even risk going to an external centre for support because they'd be so afraid it'd come on their record and they wouldn't be able to continue getting a licence in their career. So there's this definitely fear-based approach which needs to be tackled so that young people can seek help and we can prevent the accidental overdose deaths and other harms.
Hi, can I just add something?
Yeah.
Thank you, Iram. Yeah, I think this is a really good sort of opportunity for drug science societies and psychedelic research societies to come in, because they can sort of act as a sort of interplay with the society and the SU and the student body in sort of raising awareness, breaking that taboo. I mean, today we're here, the Free Speech Society, and I think one of the best things we can all do is just talk about our experiences. As long as we're not encouraging anyone else to do the same. I think more of us, if we come to talk about our experiences or the experiences of others, I think that is all sort of pushing the envelope and sending the message to the universities that this is something that is really needed. I think it's slowly happening. So there's great opportunity for societies to sort of be pushing this.
Okay, so we've had a few hands. We'll go Izzy, Ben, and then Ben Watson. So Ben Sewell and then Ben Watson. So Izzy.
Hi, Iram. I wanted to ask you, can you hear me clearly?
Yeah.
Okay. I want to ask you, isn't it, so I understand, you know, oftentimes when there's a culture of people doing drugs, let's say in fear, right, then that can cause worrying effects because, look, they're anyway doing it, but they just can't talk about issues and stuff like that, right? Or they're being pushed into doing it hiddenly, which can be more risky. But on the other hand, how do we deal with the reverse tendency that if we stop kind of demonizing it, that just means that more people are going to want to try it, right? Which might not be a bad thing, but might somebody argue that, well, do we want to have lighter regulations around these on campus and, you know, kinder language? If that will probably have the impact, then more people are going to try it. And do we want to have that kind of culture of even more drug culture?
Yeah. So half of that question answer that I can think of is, for example, alcohol. There was this binge sort of culture that's been going on in British universities of alcohol. But if you look at Generation Z, the students born in 1996 to 2010, I believe, they don't binge drink as much. They don't binge drink, and their alcohol consumptions are very low than our generation or the ones before. But that's because they've grown up with this norm that alcohol is there, they can consume it whenever they want, and they're aware of the harms and the risks and the benefits sometimes as well. And I feel like if the drugs are, if there's an open conversation on campus, firstly, the stigma will be removed because some people do have them for recreational reasons, for mental health reasons as well. And there's personal choices and curiosity. And because I believe students are going to consume them, whether there's a ban on them or not, students are going to consume them. So I would rather there be an open conversation about drugs than students not have a lack of knowledge. And for example, one of the ways I was explained this was actually that if you go into a pub and you order a beer, you want to know whether you're having a strong beer or a weak beer. You want to order it and you want to have that, and you know what you're consuming. Students, young people, and everybody want that with drugs as well. So know which drug they are taking and what the strengths are to avoid any harms with it. In terms of like how to handle if a lot of students start consuming the drugs and it goes the opposite way, I feel that there needs to be more conversations. That's where education comes into it. That's where more conversation comes into it. And once it's available, I'm not very much knowledgeable on that side just yet anyway, because I'm still learning, but I don't think it will have necessarily a bad effect. I think it would have a positive effect because the key thing would be it would prevent accidental overdose deaths, and it would remove the stigma, and students can get support. So because there's a level, I feel if you have drugs, there's a point where you're using it for recreational use, and then it can become addictive as well. So if it becomes addictive or frequent use, you want to be able to comfortably approach counsellors, approach university staff for help, and get the right help, get the right referral without thinking about how this is going to affect your course, how this is going to affect your career. So I suppose it's something within the community that is still present, and we'll just be handling it more sensibly. I hope that answered your question.
Okay, so if we can have Ben Seal.
Hi, yeah, I just want to make a comment on the point that I think, you know, very rightly brought up about medical and pharmacology students and other people in kind of health professions and studying health degrees, where there is a big risk, or at least a big perceived risk for a lot of people, that them coming forwards about their use of substances could mean that they will never be able to practice in the profession that they want to and that they're studying for. And I know that in my experience as well, like, you know, we were all told that, you know, if you were caught to be using drugs or known to be taking drugs, you know, that would bring into question your fitness to practice, because obviously, you know, nobody who you know smokes cannabis, for example, could possibly be a good doctor, at least according to the General Medical Council.
Yeah.
Which, you know, and I think that there's a definite double standard there in terms of how, let's say, alcohol is treated. And it's something that's, you know, encouraged by medical faculties because it's part of university life. But, you know, taking small amounts of drugs for recreational use, although it has, you know, much lower impacts for some people, actually it's seen as being so much worse. And I think why it's really important is because it's something that knocks on to patient care for people, for patients in hospitals who are taking drugs, especially those in lower income and homeless backgrounds, because there is still a huge amount of stigma present within hospitals towards them. So I know for a fact that there are a lot of doctors at the hospital that I'm at in Gloucester at the moment who will just look at a patient's notes and say, oh, XIVDU, or intravenous drug user. There's no such thing as an XIVDU. Once you are, you always are. And I've personally witnessed a patient that I was speaking to who, felt uncomfortable, who denied any kind of drug use previously to all the doctors on his ward, even though it was very, very important to his healthcare that he told us, and he knew that that was true, because he thought he would be stigmatized and only viewed as a drug user by healthcare professionals. And the really sad thing is, he was right that, everybody there knew that he used to take heroin because he was on methadone, but everybody just referred to him as the IVDU, not, by his bed like they would anybody else, or as the man in that bay, or by his name. It was he was just seen as a drug user because that was part of his identity.
Yeah.
And I think the way that medical schools treat drug use among students will have a knock-on effect to how those students then go on to treat patients when they graduate and become doctors.
Definitely. I also have spoken to quite a few medical students, and they mention how, if somebody came with a drug overdose, they actually wouldn't even know what to do because they're not given opioid training. I'm not sure how that is now, but in addition, they're not told about the harm reduction education of drugs, what they would say to patients in terms of harm reduction if they're going to consume drugs. It's just a stop, just stop.
Okay, thank you. And was it Ben Watson as well also had something to add?
Yeah, thanks for that story, Ben. That's interesting, kind of harrowing as well, but interesting. So my question is kind of a general question for Iram and anyone else as well. Is I was wondering why, there's so much evidence building up for kind of positive use of psychedelics, but not just positive use, of educating people about drugs and about if you've got pure drugs, then you've got less likelihood of overdose and stuff like that. So giving people testing kits is really important. And I was just wondering why, if you had any insights as to kind of why the UK seems to be so backward compared to lots of other countries. I mean, the US, they're moving forward with MDMA treatment, they're moving forward with psychedelic treatments, they've legalized cannabis in various states. Obviously we've got kind of Amsterdam, there's Spain as well, where cannabis has been deregulated or legalized, I think, for at least for some time now. And I was wondering, why are the universities waiting for a cue from the government? Are they kind of scared of going against the status quo? And until the government's really going to kind of start looking at this in a realistic way, the Conservatives seem to be really aggressively against drugs. Well, maybe not even them, but anyway, do you think it's the government, can the universities, are they kind of cowering behind this status quo? And if the government changes its outlook, then we'll see a lot more positive progression in all of these fields that we're talking about.
So I personally think that if the government changed it, would definitely progress positive, because right now, because there's this stigma associated with the law that psychedelics are in Schedule 1, Class A, they're addictive, they don't have any medical potential. It creates a stigma between the public. So because they're in that category by law, that's what the public assume. And in terms of young people in universities, so if the parents think that, universities don't want to upset parents, universities don't want to come across that they're going against law, or that they're promoting something that is said as addictive and harmful by the government. I definitely think law and politics play a big part, and I'm gonna put those two papers by Professor David Nutt. I highly recommend to read them if you want to, you know, have more knowledge on like what is impacting UK policies from moving forward. He does the 2010 one, which was about the chart I showed you where alcohol was more harmful to others and self, and LSD and mushrooms were right at the bottom. And then in the one 10 years later, he shows that a decade has gone, but there's still no improvement in UK drug policies. So, and there's really good quotes there from people as well. So I highly recommend you read those papers. But does anybody else have anything they'd like to add?
Well, I will just say that we are going to have a full-on Q&A after sort of this segment. But Izzy, if you still want to respond to what was just said, or what Iram has been, sort of the discussion points that Iram has brought up, you're free to do so.
No, I wanted to ask a general question, so maybe I can...
Okay, we'll just make a note of it, because before we head over to sort of more of what we've been doing, but just with a more back and forth Q&A, I'm just going to pass over to my colleague, Patrick, who is going to read a statement that was composed by Ruth Day, who is the Student Living Officer here at the University of Bristol, and one of these figures who was really pushing, as I understand it, for this harm reduction policy. Unfortunately, they weren't able to make the event today, but they did send Patrick a statement. So without further ado, I'll pass over to Patrick to do that really quickly, and then we will resume the Q&A discussion.
Thank you very much, Harry. So yes, as Harry was saying, Ruth Day, the Student Living Officer at the SU, an elected full-time officer, has been very active in pushing for a change to the university's drug approach, and has sent us a statement to sort of fill us in on what they've been doing, and with some further details about upcoming plans and so on. So without further ado, Ruth Day's statement. Last academic year, my predecessor, George Benrose, worked incredibly hard with Alison Gordon Wright to get the university to adopt a harm reduction approach to drugs, including alcohol. It was recognised as extremely important that we remove all the barriers to students receiving support if they are starting to struggle with using alcohol and other drugs, and also that students are as well informed as possible about the potential harms using alcohol and other drugs can cause. Since the university formalised this approach, there was a lot of activity last year, such as Be in the Know information sessions with wellbeing advisors, staff training and partnership work with UWE and other stakeholders across the city of Bristol. However, this year, when I came into the role, both the SU and the university recognised that more needed to be done this year, especially with the risks COVID posed, as licensed venues are shut and there is more scope for home use and poly use of drugs. This year, we set up a scheme with Bristol Drugs Project, where students can sign up for a short appointment with a Bristol Drugs Project worker who will offer harm reduction advice and show them how to use a drug reagent testing kit. The university has provided the funding so that every student who attends these drop-ins can receive a free drug reagent testing kit if they so wish. This is the first scheme of its kind at a UK university. Some SUs in the past have provided drug testing kits for students to pick up as they choose, but combining it with harm reduction advice is really important in ensuring that students are as informed as possible about the risks associated, and also so that they understand how testing works and what it can tell you about a drug. This scheme has been flagged by Students for Safer Drug Policy as the gold standard in the sector, and I am working on supporting a number of SUs to do similar work. In terms of the next stages for this work, we are looking at changing the residence conditions and local rules of halls so they better reflect the university's harm reduction approach, but still remain compliant with the Misuse of Drugs Act. We are also hoping to train ResiLife, wellbeing and counselling staff so they can better support students who make disclosure, as well as providing guidance to academic staff about what to do if the student makes a disclosure in an academic setting or a tutorial. If you would like more information about our work, please get in contact with me at ruthday@bristol.ac.uk in the chat. If you would like to find out more about the drop-in or sign up, you can find details on www.bristolsu.org.uk/harm reduction. And that is also in the chat. Thank you.
Thank you very much, Patrick. And yes, yeah, thank you very much for that. That's very useful to know a bit more background and get a bit more inside information. Bearing in mind this is a Bristol University event, so that's fantastic. So what we'll do now is just go a bit more like we've been doing with the Q&A section. I hope people are enjoying the format of this, so quite discursive and back and forth. But we have had a number of questions on Slido, some of which are anonymous, which I will just read as I don't know who's first.
It looks like we lost Harry.
Do you have access to the Slido?
Oh, he's coming. I think he's coming. I do have access to the Slido, yeah.
I just died for a second. I was just going to ask you, Izzy, just to ask your question. I've got Slido.
Okay, thank you. It's a sensitive question. It's a bit of a personal question. So are you happy to take questions like that or rather not?
For me? Sure, you can go ahead, and if I choose not to answer, then I'll let you know.
Sure. I wonder how, you seem to be a woman of faith, I wonder how that interacts with your research, especially I think in Islam there's quite I think drugs and alcohol is forbidden. So I wonder, lots of people might be thinking this, but I wonder how this relates with your research, if you're comfortable to answer.
Yeah, no, that's a really good question, because I've actually been preparing an answer for that for a while, because I knew one point or another it would come in. So I have somewhat an answer for this, but I'm not exactly 100% comfortable or confident in answering because I've not researched well enough myself. But I think in terms of like, so there's a half of a question that I could answer, but I'm not confident enough it yet. But I will take your email and I'll contact you and we can have a personal discussion. I don't mind. But on the other half, I think it's preventing accidental overdose deaths. If I'm looking at drug use, it's harm reduction. We're not saying do drugs. We're not saying, no one is saying do drugs. Everyone is saying if you want to do drugs, there's a safe way of doing them. We're also looking at, I mean, this is my personal opinion, so I'm not speaking on behalf of all Muslims or anything, but also if we look at the drugs, if they are there helping people with mental health, helping to cure illnesses, helping with addiction, then technically I haven't researched into this from an Islamic perspective. This is my personal opinion, and from the little much I know, I don't see anything wrong with it because my religion clearly says as well that there's a cure out there for every illness, every disease, and we're using it for medical purposes. So yeah, that's my personal opinion, but I still have so much research myself to do. But yeah, it's harm reduction, it's preventing people from overdosing, it's creating a society where stigma can be, the conversation and the use of drugs can be destigmatized, and in terms of alcohol, again, it's the same thing. It's teaching, because one of the reasons I got into this field of substance misuse in young people was through reading papers while I was volunteering for Professor Christopher Armitage and Corrine, and Dr. Queen, who's in here as well. And there was a lot of papers about alcohol use on campus and how much binge drinking young people did. So again, it's about harm reduction, it's education that you'll go on to developing alcohol use disorder and other attached and associated conditions, and also to understand the underlying reasons why are people binge drinking. Sometimes people will binge drink to deal with anxiety or depression. So yeah, I think there's a harm reduction approach. We're not saying do drugs, so I don't see anything wrong with it.
Thank you.
Thank you so much, Iram. Thank you for being so open. So what I'll do now is just go in order of the questions I've got on Slido, and so once we've got through that, if people want to raise hands as we did last time, that's fine. So the first question is from Anonymous, and that is, how do we know that we aren't just replacing one addiction, alcohol, tobacco, with another?
Sorry, can you repeat that again?
Yeah, sure. So it says, how do we know that we aren't just replacing one addiction, brackets, alcohol, tobacco, with another?
I think this goes back to the question that somebody else asked before about are we not increasing the usage by legalizing it, by making a more harm reduction approach on campus? And again, I don't think we are. No, we're not increasing addiction from one substance to another. We're creating a environment where people who do use or choose to use, because whether whatever the policy is, young people and individuals are going to consume them. I don't think that it's creating an addiction of another substance. And from the research perspective, the psychedelics, LSD and psilocybin, they have very less addictive properties. They're not addictive. If you look at the research, they help with dealing, they contribute towards tackling alcohol addiction and tobacco addiction. They have a very lack of addictive properties in them.
Okay, thank you. The next question is, were there any interesting differences in effects along demographics in any of these studies?
That is a good question. Any particular study that they have liked that I can email them?
Yeah, I'll just invite the person who asked that question to, if they feel comfortable, just like let themselves know, maybe expand on that.
Yeah, if there's a particular paper, because I can always, I can give my email address and they can email me and I can always forward it to them. Due to the lack of timing, I couldn't go into a lot of the studies that I wanted to about tobacco addiction as well and about the demographics and stuff. I don't think I put the demographic information here, no. I mean, in terms of gender, they all have mainly male, especially the 6 LSD trials. There were only 2 females in all of them. And in terms of demographic, in terms of age, I think they're all adults, and in terms of they'd all be mostly white males. So okay. That's another reason why we want to actually continue the study, so that we can see the effects on them, how they are used, and the therapeutic effects on them in a wide range of participants.
Do you have any insight to the politics behind the UN's restrictive regulations?
No, but I have forwarded 2 papers. I would advise to read them because they're very good in terms of the political side as well, by Professor David Nutt. Yeah. Okay.
Brilliant. So just check the chat for that one. These ones have been submitted like earlier on, so it's possible that the askers may have missed.
No, that's okay. I don't personally. I'm still developing my law side of the knowledge and my policy side of the knowledge a bit more. I mainly used to read up on the young people's effect and in mental health relation, but getting to the other sections as well of psychedelics, which I'm enjoying.
Fantastic. So the next question is, do we know what the relationship is between drugs being harmful because they are illegal, or drugs being harmful because they are legal and more people take them?
Sorry, could you say that again?
Yeah, sorry. So basically, what is the relationship between drugs being, the fact that drugs, like, are drugs more harmful because they're illegal, or would... Yeah, I guess that's like...
It's a confusing question. It's a very confusing question. I didn't understand it either. I think it's basically saying...
Yeah, I think that was mine. I think it's basically like, do the risks of people like you showed that chart with the LSD and the alcohol, like, is alcohol more harmful because more people consume it, or like, would LSD be less harmful if it was legal because there'd be less overdoses?
I think the paper, let me just go back to it 1 second. So the paper looked at thousands of harms and condensed into 16 different variables. So I don't think it's because it's more available. I think they looked at the harms of consumption and how the substance affected them and how they were in society. And I think that's what they did with LSD and all of the other drugs as well. So from my understanding, that's why Professor David Nutt, he had said that cannabis was less harmful than alcohol and tobacco. So the harms, it's. I don't think it's to do with it being legal and illegal. I think it's more to do with once you've consumed the drug, how do you behave and what effect does the substance have in you? I thought that study related to it as well, the one that Alex posted, but that's more to do with young people. But yeah, no, I don't think it's the illegal thing. I think it's more to do with the after the consumption.
Okay, so the next question is actually my question, and that is, so I guess one thing I'm interested to know is, like, is this, if we're talking about the sort of harm reduction through education, is this comparable to sort of other things in education, like sex education, for example? You know, we kind of see that perhaps sex education in a similar way, young people are going to continue to have sex, and therefore, you know, in a similar way to the fact that young people are going to continue to use drugs, regardless if it's, you know, legal or encouraged. So I guess my question is kind of like, is it comparable? Because I think we can all agree that, or a lot of people can generally agree that sex education is positive and has positive outcomes for the fact of it lessens the number of like teenage pregnancies and people understand how contraception works. And actually, even for younger children, it can actually have the potential to make them less at risk of sexual abuse as well, because they kind of understand that that's something that is for adults. It's not, you know, that certain behavior is something that, you know, you shouldn't talk to strangers, this kind of thing. So I'm just sort of curious to know, like, where this conversation comes in reference to these other issues.
Yeah, I think that's very similar. I think the points you made are very valid. Like, by having sex education, they're aware of when they might be being abused, of the risks of having sex without a condom, etc. And I think that's kind of the same with drug education and harm reduction, because the key thing is for them to know when are they becoming addicted, when do they need support, for them to know what are the reasons behind them consuming the drug. Are they consuming it, you know, as a avoidance mechanism? So they might want to take, you know, help for any issues such as anxiety, or are they taking it for recreational reasons? Are they taking it for curious reasons? Also, it teaches them about not mixing drugs, not mixing a drug with alcohol. It's just knowledge of preventing any accidents, any overdoses. So yeah, I think they're quite similar like that. Yeah.
Okay, thank you. The next question is from Alison. So if Alison is happy to, are you able to ask the question yourself? Perhaps switch on your camera if you want, if you'd like to. Unless that's someone on the stream on Facebook. Do we have an Alison in here? Okay, in which case I'll just ask Alison's question. So regarding alcohol, societal norms change, but knowledge is power in any area of life. Governments of any colour cannot risk changing the drug laws in any meaningful way.
So is that a question or a statement?
When I read it, it sounded more like a statement, I suppose.
Yeah, I think it's more of a statement. I like the knowledge is power.
Okay, if Alison has, if you want to add anything to that, perhaps comment in the live stream if you're still there. And then the next question, in fact, the last question we have on the Slido is from Ben Sewell again. So Ben, you want to ask your question again?
Yeah, hi. We've touched on it kind of briefly in relation to a couple of other things, but my question was, which groups do you think are potentially most at risk of substance abuse? and which groups do you think need most support when it comes to substance abuse? So we've talked about like medics and potentially people from religious backgrounds, but are there like, do you have wider opinions on that, I guess?
So I don't unfortunately have a wide opinion, because I think for a while I've mainly studied the reasonings behind substance misuse in young people, and I've mainly gone into young people. I think to be honest, I do think it is young people, because if they don't have the drug education and harm reduction knowledge while they're on campus and even earlier in high school and college, because I believe there's facts such as, 15-year-olds, over half of 15-year-olds are approached by drug dealers. Drug dealers don't ask for ID, something like that. It says it on the Anyone's Child website. But I feel if they don't have that education in high school and college, and especially in universities, they might be using it out of curiosity, they might be using it for recreational, they might be using it for whichever reasons, and then they can't seek help. So let's say a medical student, even, they can't seek help because they're afraid of their license or any other reasons, being kicked out of halls, etc. Drugs can then, such as alcohol, even alcohol, be used as a mechanism to cope with stress, to cope with other underlying conditions, but especially stress, especially academic stress even. And if they don't get the right support, I feel then it progresses into their adulthood. If you look at the longitudinal studies, that's what they show as well. And then alcohol can lead to alcohol use disorder if they're relying on alcohol for coping with stress, academic pressures, coping with anxiety. And then the same with substance misuse. If they don't receive the right help at that time, before from like 15 up until 24, later on it becomes addiction, it becomes a form of reliance. So I feel young people, because it can have long-term effects.
Okay, so as I said, that's the last of the questions on Slido. So I don't know what my other members of the committee on both our societies are saying, but I'd be happy to just kind of open it up to free-form discussion now, sort of as we were earlier. And if people have questions they want to, or contributions, they can just do that by interacting with the emojis or switching on their camera. Does that sound okay with everyone?
I would also note that if people want to share their experiences, as this event is being recorded, if there is something that you say that you don't want to there to be like a public record of, then just tell us and we'll have it removed from the recording when we later upload.
Well, that's almost what I'm thinking. I'm almost thinking that we could end the live stream here.
Why don't we give the live stream another 10 minutes until 8:30? In the meantime, we'll take more questions, and then at 8:30, we'll finish the live stream and then make it a more intimate event.
Sounds good to me.
Okay. On that note, I have a question.
Please.
What are the, obviously a lot of students on campus take various drugs. I'm wondering specifically for cannabis, what are the harmful effects of doing cannabis?
Oh, good question. So I've been doing research a lot more in classic psychedelics and stuff. So I'm not 100% sure what are the harms of that one, but I know, so they've been, they're allowed to be prescribed by doctors for medical reasons. I'm not sure too much on that one, but I'm not too sure on that one.
Do you know what medical reasons means? Like, is that like microdosing, or is that just, some people are just prescribed cannabis to smoke? Or?
I think they're prescribed because you can only have them if you have a prescription to possess them at home. But again, I'm not 100% sure on the medical reasonings behind it. So I could get back to you on that one if you want. I'm not 100% sure on the reasons and the effects of cannabis addiction.
If you go on Frank, there's information there about risks and addiction of anything.
Yeah.
Go on where?
Frank, or talk to Frank. I'll pop a link in the chat.
Thank you, Emily. Ben, did you have something you wanted to say?
Yeah, so I mean, just as a little thing, because within medicine we do a little bit on the effects of drug use. So I think the main things that generally with cannabis, it's not so much necessarily physical addiction that's a problem. It's more like a habitual addiction that happens for quite a lot of people related to a lot of things. But in terms of more, objective health issues related to it, I think the big ones that people worry about are potential mental health issues, which are especially common with people who start smoking quite a lot from a young age. It's, I think, as well, especially if you're younger and male, then you have higher risks of, say, a lung collapsing or a pneumothorax, it's called in medicine. There's also specific kinds of COPD, lung conditions that can have their risks increased by cannabis. And the only one that I'm aware of at the moment that's very cannabis specific is there's a condition called cannabinoid hyperemesis syndrome, which is something that happens to long-term, especially young drug users, where effectively they, because of long-term cannabis use, they effectively throw up very often, and not just after drug use, but largely like in the mornings they'll wake up and just be sick. So those are the kind of big risk factors with cannabis that people look at.
I've put a link from Drug Science on the cannabis page. I usually get my drug information from there, and it's a really good page. It really breaks it down for you. How harmful is cannabis use? What is the experience that cannabis users normally get? And if you go to the what about physical effects, it says that cannabis is one of the least toxic drugs. And then at the bottom, it's that occasionally after using cannabis, people feel their heart flutter, skip beats, race or pound in their chest. And make any anxiety worse. But yeah, this page is really good. They have these educational ones for psychedelics as well.
Thank you very much for those resources. Oh, sorry.
I was just saying there's a podcast there as well in the same link.
Yeah, it seems like there are a lot of resources, like despite the sort of institutional barriers perhaps that are about talking about these issues honestly, there does seem to be quite a lot of resources that, you know, young people at university can access regardless of the attitude that the university or the stance that their university has taken on the issue. So I guess, yeah, it's probably just worth, obviously, thank you very much for sending that material to the chat on Zoom, but perhaps we can also try and make that available as well, sort of going forward, both on the Free Speech page and the Drug Science and Psychedelic Research Society page here at Bristol.
Yeah, can I just add to that, Harry?
Please.
Yeah, so I think the fact that, especially now that it's the third wave in the last 5 years, we've seen much more psychedelic research reaching the tabloids. I don't know about you guys, but I've seen plenty of articles going around about all the benefits and potential benefits of ketamine, LSD, psilocybin. And I think this is kind of presenting some new risks because it's, in my own experience, I was seeing these some years ago and thinking, oh, all the talk to Frank, all the government regulations, all the policy is a complete lie. Sort of threw the baby out with the bathwater, and then, you know, didn't look at the research enough to know that these benefits were happening under clinical conditions, and that you can't just take this on a night out with your mates and expect to have, you know, the same benefits. So I think, yeah, it's really good that there is a lot of information out there now, but we have to kind of be careful when we're navigating it, because there is a lot of sensationalist media talking about the benefits of psychedelics, and, you know, we don't always read the whole article. Sometimes we just read the headline, and I think it's worth just doing the extra bit of investigation if you are interested in it.
And that would be just the last thing I would add as well before we sort of come to the end of the live stream as well. So that kind of nicely ties into the reason that we decided to put on this event as the Free Speech Society, of course, in collaboration, is because, you know, we genuinely do sort of see that this is a conversation that needs to happen, especially with students and young people, and in a sort of both in the academic sense and also the sort of health and safety sense, and the prevention of people frankly losing their lives, which is the sort of worst case scenario. So, you know, that's kind of our motivation from the free speech part of it for this event. So I reckon now would probably be quite a good time to say goodbye to the people.
I have put links over here that I mentioned in the talk about writing a letter to your MP from anyone's child, writing a letter from the Conservative Policy Reform Group for psilocybin rescheduling, and the neuropsych drugs survey as well.
Okay, thank you. So yeah, just perhaps as a last question before we end the live stream, as someone on my committee suggested, what can students do to encourage research and implement the harm reduction policies at university in general? Of course, you've spoken very well about, you know, and given some resources for, you know, government stuff that we can sort of do and MP things, but in terms of what you can actually do on campus.
Yeah, I think the Students' Union from, I know, you know, having student societies, for example, and Students for Sensible Drug Policy, but having these type of societies on campus to promote the idea of harm reduction, to allow students to know they have a society which will support them. And these societies, for example, SSDP in all of the universities have various sessions where they can discuss policy, where they discuss harm reduction, drugs and mental health. UCL and Durham just did a discussion recently, and I know Manchester will be doing many as well. So yeah, have a society, and I think also, yeah, through the society, promote the harm reduction if you can't, if the university itself isn't doing it, and yeah, whether that's harm reduction material content or events,